Hey, and welcome to Very Nice Smile. Thanks for joining me. I'm Dr. Rich. Today, I'm going to show you how I replace this old failing composite. There's a little bit of recurrent decay right there that you can see. So, tooth's already been numbed up. I got an isolite in place. And first thing I do is I take my high-speed handpiece. This is the drill just to remove the old white filling. Now, white fillings are a little tougher sometimes to remove than silver fillings. Big main reason is that a white filling kind of matches the color of the tooth. It's not an exact match, so if you look close you can see the difference, but it's not as big a difference as, say, a silver filling versus a tooth. And then another thing with white fillings is white fillings are generally bonded into the tooth. Basically they're glued in. So unless the bonds failed, like on that little section there where it just popped out, if the bonds failed, then it'll pop out easy. If it's not, like on these other sections where I'm trying to pop it out, see if I can pop it out, the bond is still there. So I'm going to have to grind those out. Versus a silver filling, silver fillings don't use any bonding agent to hold them in. So basically you can pretty much just cut the silver filling into pieces. Once you cut it enough, the pieces will start to fall out. So here I am just removing a little bit more. It's kind of a painstaking process. You remove some, go back and check. Now I got most of it out. Now I have my slow speed handpiece. So this is a drill, it doesn't spin as fast as the high speed. And this I'm using to clean up any decay. So the decay was in the back there. And now I'm also kind of running over top of the old filling material if there's any left. There's still a couple pieces in there, and as I remove the decay, I noticed there's a little crack in the back. Can you see it there? Running on the back wall, the distal wall of the tooth. So at that point, talk to a patient about it. Ideally, with a crack like that, I would prefer to put a crown on the tooth. Patient doesn't really want to spend the money on a crown, so we said, oh, can you do the best you can with the filling? So what I'm doing is I'm chasing the crack. Basically, I want to get rid of the crack as far as I can. Obviously, if it's bad and it goes into the nerve, we stop drilling into the nerve. But the person didn't have any issues with the tooth, no pain or anything. Another little bit of filling material popping, flaking out. You can see it in the back. See it in the back of the tooth there. There's a little bit right there. Got that out. So sometimes too, just the drilling of the filling material loosens the bond up, and then there you can see where the crack was and how I drilled the crack away. So hopefully this tooth won't give him any trouble. So we'll see how it goes. So, but again, just a tedious process at this point, making sure I have all the old filling out, and now I'm going back in there cleaning up any little bit of decay that's still left. Now usually we can check for decay. Color wise, it's usually a little darker color and it feels a little soft to the touch. So the tooth's all ready to be filled now, so I'm going to set up a matrix band in a Tafelmeyer retainer. This is just a regular Tafelmeyer matrix band. It's not a greater curve band or anything. I just need this to hold the silver filling in the backside where I drilled out that the crack. Put it around the tooth, and then I adjust the retainer to cinch it into place. You gotta be real careful not to catch the person's lip while you're doing it. Having a beard like this gentleman does makes it much more difficult as well. I gotta make sure not to catch any of his beard hairs. Closer look at the tooth, and that's just how it looks right before we get ready to fill. And now here we're mixing up some silver filling. Now you might wonder why am I placing a silver filling in this tooth rather than another white filling? Well, first off, I asked the patient which he would prefer, and he told me he doesn't care what I used. He would prefer I use the longest lasting material. So I said, you know what, let's go with silver filling. Second molar, way in the back, you're not going to see it. So he was okay with it. We also did another tooth, the same tooth above this one. So this is tooth number 31. The other tooth that we filled was tooth number 2. Again, a second molar. So we just put the silver filling material in increments and then smush it into place with instruments that are called amalgam condensers. So they come in different sizes. I'm using a smaller one now to get the material make sure it's smushed down into all the little nooks and crannies. That's another thing when you're prepping a tooth that you're going to place a silver filling in there. You have to have enough room to get your smallest condenser in to be able to condense the filling enough so you have a nice firm mix. Then we just put it together, just putting another layer on, building it up piece by piece. Basically with silver fillings, you want to overfill it, and then once it's filled up, then you trim it back and carve it back. That's a little bit different than a white filling, where you try to get the contours as close to perfect as you can when you're placing it. So I typically use a fast set amalgam. We got to mix up another spill of it. So the carpules I use, the amalgam capsules that I use, come from the factory. There's a little powder, metal powder in there with a little bit of mercury. In the old days, dentists had to buy the mercury, bottles of mercury separate from the powder. And in the really old days, they just mixed it up with a mortar and pestle. Later on, they would actually just put it together in little plastic syringes that were reusable. Now it's all single-use disposable ones, so you don't have to touch the mercury. The old mortar and pestle days, the dentists used to make the mercury, the amalgam mix a little wet, so use a little bit more, too much mercury, and then they would put it into a cheesecloth and squeeze out the extra. Kind of scary if you think about it, because this was back in the days when they didn't even wear gloves. So glad those days are gone. So putting the last layer, this was not a large filling. I only used 2 spills of amalgam. I believe off the top of my head, a spill is 200 milligrams of material. They make the capsules in different sizes. I think 3 spill, so 600 milligrams of the material. For the stuff I routinely use nowadays, times I need it, I'm placing pretty small fillings. I'm not doing any huge amalgam crowns or where the entire big large pin amalgams like we used to do back in the days before white fillings were very popular. So first instrument I use is a Christmas tree carver. Now that's a diamond carver to get the shape. Sometimes I can use this, but it kind of depends on the tooth, the shape of the tooth. In this case, it's okay. It's not my favorite. I'm going to go back to the Christmas tree burnisher because this one's not working so well for me. And there we go with the Christmas tree. Now we call it a Christmas tree. It's technically an acorn burnisher, but if you look at the head of it in profile, it looks shaped like a Christmas tree. And you just kind of smush it in there and follow the grooves to shape it. So now it's all in place. Let's take the matrix band off. I'm going to make sure I smooth the backside there, make sure it's even. And now I'm using a Hollenbeck carver to finish carving the amalgam. So these carvers are nice because you basically lay them against the sides of the tooth that are still there, and that gives you the angle as to where you're trimming the silver filling to. So that can get you pretty close to to proper anatomy so that it fits into the bite pretty well. And once I do that, I'll go back in with my Christmas tree to kind of just put some of those grooves in there that are normally there. And there you have it. Finished filling. I guess I wasn't quite finished. Going to trim it a little bit more and still need to adjust the bite. That's always going to be the last step of it. You got to let the material, the amalgams, has to set up a little bit. At this point too, when you're carving it, you can actually feel it kind of squeak a little bit when you know you're at the right point where it's firm enough that you don't have to really worry about it breaking. So I'm going to remove the isolite, check it with some occlusal paper. There's a little bite, one spot, a little blue spot, still a little high. So let's trim it back. And I think that will do it. All right. Well, thank you guys all so much for watching. I really appreciate it. These are some new videos that I'm trying out. I got a new video camera that mounts on my loop. Thanks so much for watching. See you in the next video.